Good evening. My name is Bruce Berghegger. I'm charge nurse at Swedish-Ballard Hospital. I've worked for Swedish for 16 years. I want to tell you about an incident that occurred just last month on April 9th. As a charge nurse, I came onto the unit that night and it was brought to my attention that we had a staffing problem that night. In report, I heard from the day shift charge nurse that we were going to be short-staffed that night. I immediately raised my concern with the day shift nursing supervisor over at Ballard that I was concerned about staffing our unit that night. I was told that there was no one else and we were adequately staffed, I was told. I raised my concern and within the next 45 minutes with the night nursing supervisor who came on duty, again raising my concern that we were not properly staffed and there was going to be a safety issue on our floor that night. My nurse manager came onto the floor that night, also probably within the first hour and a half of my night. I grabbed her immediately and brought to her the attention that we were short-staffed. We didn't have the staff that we needed. Also, one of the nurses who was working on our floor was a temporary nurse who had just had one night of orientation the night before. And I was told that he was prepared to take a patient assignment, which proved not to be true at all. One night of orientation to a specialty floor does not qualify a nurse to work on our floor. Approximately 10 o'clock at night, throughout the evening, we had several high acuity patients, one of which was going through severe alcohol withdrawal, escalating in his confusion, and needing additional care. I notified our medical director that night of the problem we were having with the patient. An order was placed for the patient to have one-to-one care, having it sit at the bedside. At about 10 after 10, I responded to the patient's room when his bed alarm went off, notifying us that he was out of bed and he was a high fall risk. I was greeted in his room by the patient standing, wielding an IV pole that he had taken off the head of the bed and utilized it as a baseball bat against me. I was viciously assaulted that night. And that's just one example of what could have happened to anybody in the hospital system at any time. I just happened to be the unlucky person. I notified management that we didn't have the proper help. And this is what can happen. Thank you.